Okay, good afternoon, Mr. Angle. We're going to be doing your blood pressure today, measuring how that is working. We're going to clean all the instruments, the sphygmomanometer, okay? And then we're going to be assessing the blood pressure. We're going to pump all the way to 200, and then you're going to slowly release the valve 2 to 3 millimeters of mercury at a time. Okay. Now, you also have the blood pressure cuff. You want to make sure the blood pressure cuff, the artery mark is on her artery, which I'll show you in a minute. The room lighting and all of that doesn't matter for this. The only thing that you want to make sure is that you can see the scale. Okay. So we're going to make sure that she has no clothes covering that area, or you're going to have to release it so that there's not extra pressure being caused here. And then you want to make sure her arm is rested and comfortable to take the pressure. Okay. So we tell the patient this is going to form a little bit of pressure. Now, the other thing that you want to make sure that you do is that this gauge is all the way to the right. It has to be closed in order for air to gather so she is able to measure the blood pressure. She can put her arm down. The other thing you want to do is that your stethoscope has to be in that same spot. So you have to be able to hear the artery pumping in order for you to be able to measure correctly. Now, you do not want to put your thumb there because your thumb has a blood pressure and you will be able to hear it. So you don't want it to alternate her blood pressure. So some people do this sitting down. It's up to you how comfortable you are. So that's what I'm trying to do to myself. Okay. And I want to make sure I can see. So you can put that right there. Don't use your thumb. And it's on tight. And you pump all the way to 200. And then I'm going to stop talking so that I can hear the blood pressure thumping. The first number you hear is the systolic. And it's going to be a big thump. The second one is the diastolic, the last thump. So the first number I heard was right around here in the gauge, about 110. And the last number I heard was about here at 70. So it's about 110 over 70. Now, the other thing is this is not my stethoscope. So one of the things that as a person using a stethoscope that's in the office is that, right, this is a little big for me, so they hurt. The other thing that's uncomfortable in this situation is the mask. So please make sure you understand that when you do all this and it's uncomfortable already, you hear extra noises. Okay? So some people bring their own. That's up to you. First pressure, systolic. Second thump, diastolic. The bumps in between, do not listen to those. The first one is the most important and the last one.